heparin-induced thrombocytopenia is a disorder that happens when we give the blood thinner heparin. And what we're trying to do with heparin is to make it so a patient doesn't clot because they have some reason that they're more likely to have a blood clot. And what happens in heparin-induced thrombocytopenia is the opposite. There's actually reactions that go on with the heparin in the body, and patients don't bleed from that, which is a side effect sometimes you would have from too much heparin, but they actually cause clotting, and that's what we're trying to prevent. So that's obviously an undesirable outcome, and that can lead to very serious types of clots that can be life-threatening. Right now, the treatment for heparin-induced thrombocytopenia is to take away the heparin, which is often needed for certain patients, and replace it with some other anticoagulant, usually what's called a direct thrombin inhibitor. And the problems with that are that the direct thrombin inhibitor does cause a significant risk of bleeding in those patients, and it also is not particularly effective at reducing the risk of a clot, which is really what we're trying to do, is not have these patients clot once the HITT has occurred. So the main purpose of the research is to understand what's happening with the heparin and another molecule in the platelet called platelet factor 4, and to disrupt that process. Because if we can disrupt that process, we can do something that actually gets at what's happening because of HITT rather than the treatment now, which is to use overall general anticoagulation with this direct thrombin inhibitor. And we think we can improve the safety and how well the treatment works for patients who have HITT.